The topic that I chose to present on was Silas Mitchell and phantom limb pain. Background information on Mitchell includes that he was born, raised, and educated in Philadelphia, and he was well known as an American physician and writer of wartime psychology and historical romance novels. After attending the University of Pennsylvania for undergraduate, he went on to study medicine at Thomas Jefferson University. Upon graduation, Mitchell studied in Paris for 1 year, but soon returned home to practice with his father, who worked as a physician with his own private practice at the time. Eventually, Mitchell was able to completely take over the practice. However, at the time of the Civil War, Mitchell enlisted as a contract surgeon and was placed locally to Filbert Street Military Hospital before he was transferred to Turner's Lane Hospital, which was also in Philadelphia. Turner's Lane was dedicated to treating soldiers with traumatic nerve injuries and amputations and was commonly referred to as Stump Hospital. Through his work at Turner's Lane, Mitchell became the first physician to coin the term phantom limb pain, or PLP, and provide a clinical explanation of the phenomena. He aimed to convey some of his clinical findings in a fictional novel that he wrote called The Strange Case of George Dedlow. He utilizes the main character, a Union officer and quadruple amputee, to explain the phenomena of PLP. According to Mitchell, when a limb was cut off, the nerves would become obviously irritated and convey sensations back to the brain. The symptoms he reported included pain, sensations of cramping, limb flexion, and finally the telescoping phenomenon. Many patients with PLP say that it feels like when the lower leg has been amputated, the foot is attached at the knee, or when the lower arm has been amputated, the hand is attached at the elbow. Finally, Mitchell is also credited with discovering and treating causalgia, a condition that many of his patients experienced before amputation. He described this as a consequence of peripheral nerve damage. Although phantom limb pain was originally thought to be a psychological issue, we now know that the pain originates in the spinal cord and brain. Using PET scans and MRIs, it was found that when a person feels PLP, certain parts of the brain that had been previously linked to the nerves of the amputated limb show activity, while the patient feels phantom pain. It is possible that the pain is a response to mixed signals coming from the brain caused by a loss of input from the absent limb. Other factors that are thought to contribute are damaged nerve endings, scar tissue at the amputation site, and the memory of the physical pain before the amputation of the affected area. There is no medical test to diagnose PLP, and finding a treatment can often be very difficult. Doctors usually start by prescribing medications and trying non-invasive techniques such as acupuncture and transcutaneous nerve stimulation. Although there is no one medication that can be prescribed for PLP, doctors may recommend antidepressants, narcotics, or anticonvulsants. Finally, another therapy that could be used is called mirror box therapy. This involves performing exercises using a mirror to show the reflection of the intact limb. It allows the patient to imagine that they are moving the missing limb, and oftentimes provides relief for patients. To conclude, the mechanism of PLP is still unknown and treatments are not always effective.